Hello everyone, this is Dr. Patterson and I just wanted to welcome you to week 5. I can't believe we made it to week 5 already. This week's topics include neuro, genitourinary, and reproductive systems. You also will have exam 2. First, we would just like to check in and see how everyone is doing. We know that with the virus, it's an ever-changing situation, so we really appreciate your flexibility, especially during lab time and the changes we had to make to lab. So we appreciate that. If you have any questions, personal questions, shoot us an email. Any course-related questions, try to post those on the discussion board, just because more than likely someone else has the same question and we would be able to answer your question more efficiently if you post it to the discussion board. Then we're going to go over the weekly review guide, talk about some important system assessment concepts, and we're actually not going to have a case study this week because we have our exam. Important points from week 4. We want to make sure you can identify a pertinent health history as it relates to nutrition and the cardiac and integumentary systems. We want to make sure you can identify landmarks for auscultation and the sites for inspection of the heart and neck vessels. Also, it's important to differentiate between normal and abnormal heart and carotid sounds. And we talked about this some during lab. And also perform the physical assessment of the skin, hair, and nails, and be able to document the findings, and also perform a nutritional assessment. So to be completed before lab, you are to watch this video, so you're doing that right now, so good job. And then you need to review the anatomy and physiology as needed. Make sure you watch the multimedia lecture videos for neuro and GU and mark them as reviewed. You're going to read your assigned pages in Jarvis, chapters 5, 24, and 25 through 27, and the appropriate pages are posted in Blackboard. You are to review the physical assessment of the adult, the step-by-step viewing of the neurologic system in the ATI skills modules, and review the skills lab's information. Even though we don't have lab, there's still information for you to review as far as what you're going to need to know for checkoffs for neuro. So as far as assignments go, you have your documentation note, and that's going to be submitted via MedAffinity. It is your health history assignment, and that is going to be due Sunday, July 19th by 11:59. You'll also have exam 2, which will be held Monday, July 13th at 1:30 p.m. We'll send out testing information as soon as possible. And then just looking ahead, we have a new group case study due date, and that is going to be on Sunday, August the 2nd at 11:59 p.m. Important system assessment concepts when it comes to neuro and GU and reproductive. For subjective, you want to remember to use old carts as your guide. For subjective information for neuro, you want to think about memory. You can ask the patient how their memory, have they had any memory loss or trouble with their memory, their cognition, their emotional state or moods, if they're having any anxiety, depression symptoms. And then for objective information for neuro, you can look at your patient and assess their posture and their body movements. You can also objectively assess their dress, grooming, and hygiene, their pupillary responses, level of consciousness, speech, and mood and affect. For the subjective information for GU and reproductive, you can ask the patient if they've been experiencing any dysuria, frequency, or urgency. You can ask them about their urine color, if they have any pain, lesions, or discharge, lumps or swelling. You can also ask them about their sexual activity and or contraceptive use. For the objective portion for GU and reproductive, the assessment will be based on subjective The objective portion will be based on your subjective findings. So please read about the genitourinary exam in your text, as we will not be assessing these systems in this course. Important system assessment findings for neuro. A normal neuro assessment would be your patient is alert and oriented ×4 with no abnormalities in appearance, dress, or behavior. Their pupils are equal and round and reactive to light in a combination. The muscle strength is equal. It's 5 out of 5. Don't forget to rate your muscle strength, and there is no pronator drift. An abnormal exam would be if your patient was ANO maybe ×1 or maybe ×2. If they're lethargic, they're not alert, they're dressed inappropriately for the season, maybe they have muscle weakness. If you had maybe somebody that had a 2 out of 5 on the left, they may have had a stroke and it affected their left side, and the right they had 5 out of 5 strength. And make sure you put upper and lower extremities. And then if you have pronator drift, if it's present and the patient has weakness on the left, it would be downward and on the left side. So that's how you would document normal and abnormal neuro exams. I hope this video was helpful. And again, if you have any questions, please don't hesitate to ask us. Like I said, email us for personal questions or post it in the discussion board if it's a course-related question. I think that's it. I hope you'll have a wonderful week, and we'll see you soon. Bye.